At the ongoing 31st Nigerian Economic Summit, discussions focus on boosting Nigeria's role in global trade and creating sustainable jobs. In a session titled One Nigeria, Many Markets, panelists urged a shift in focus beyond Abuja and Lagos. They called for each state to build on its unique strengths, moving from production to processing, while stressing that growth without infrastructure and human capital will not be sustainable.
Every policy we bring that is going to attract investment into national state, we try to back it by law. And the reason why we do that is because we don't know who are coming after us, whether they are going to be as serious and committed to investment as we are. So that's the reason why we actually back everything by law.
If in a different Minister of Agriculture, for example, certain things are planned to be done, we want to produce certain crops, we want to give emphasis on certain crops, then we need to identify the states that can produce those crops, see how we can be able to have collaborations and partnerships with them, and see at the end of the day, how do we measure that target we set for ourselves? Have we been able to achieve those targets?
What we don't often talk about is the cost of input materials for production processes, which is a far greater contributor than even the cost of distribution or the cost of actual production. The sooner we are able to process most of our input materials locally, the better competitive we would be.
Attention also turned to the health sector, with participants stressing that no economy can thrive without a healthy and productive workforce. They underscored the importance of equitable access to healthcare, nutrition, and strong public health systems as key drivers of national productivity. Experts further called on both government and the private sector to treat health not as an expenditure, but as an investment in the nation's human capital.
If you have the means, you probably would have access to care. If you're poor, there is not even, you probably would not have any care at all. So the inequality is wide in there. So the intervention is to make sure that no woman in Nigeria right now who has an emergency obstetric condition would lack access to care.
For you to address health, you need to also look at health from the perspective of what is health bringing back to you. So in planning your human resources, for instance, are you planning your human resources based on your disease model? Are you planning it based on your fiscal realities? Are you also planning it based on what is sustainable beyond the ODA support that you're getting?
As conversations continue over the 3-day summit, attention now shifts to refining actionable plans that can turn these ideas into tangible reforms, setting Nigeria firmly on the path towards inclusive and sustainable growth by 2030. In Abuja, for News Central, Sumaya Abubakar.